Welcome to Doc Talk, where we talk about topics that our patients are asking about. I'm Dr. Elizabeth Sander, a board-certified general internist. Today, we're talking about immunizations. So vaccines are important, I think, really for two reasons. And the first is that it prevents suffering, or at least diminishes the symptoms of these various diseases. And even though there are medications that could potentially reduce your symptoms, if there's a way to prevent it, why wouldn't you want to prevent the symptoms, the illness, as opposed to waiting to get it and then treating it? And then for younger people who are still working, or even older people who are still working, it prevents loss of work and potentially loss of income. So I think those are the two main reasons. Prevent or reduce your suffering and prevent loss of work and income. So for a younger adult, and that's typically someone under the age of 50, we recommend an annual influenza vaccine and keeping your tetanus with pertussis and diphtheria up to date, and that's typically every 10 years. At age 50, we recommend a shingles vaccine for everyone. If you have chronic diseases like diabetes, hypertension, lung disease, chronic liver disease, then we recommend a pneumococcal vaccine at age 50 as well. RSV vaccine is respiratory syncytial virus. That's a relatively new vaccine recommendation for adults. We've seen RSV in children for many years, but I would say probably in the last 8 to 10 years we've started seeing it in adults as well. And so again, if you have chronic illnesses, it's recommended at age 60. At age 65, regardless of conditions, pneumococcal vaccine and RSV are recommended. So for that grandparent caregiver, they should have their tetanus with pertussis and diphtheria up to date. They should have an annual flu vaccine, and they should definitely have pneumococcal vaccine and RSV. I'm Dr. Elizabeth Sander for Doc Talk. Here's to your health.